Hi there, I'm Alana Kirby at the Movement Disorders Clinic at Rush University Medical Center. We've been taking care of patients via telemedicine for a couple of years now, so we know how to do it. Here are some tips for setting up your home equipment so that you're ready for your telemedicine appointment. Okay, so first let's talk about your options for what you're going to use to do your visit from home. A tablet is a good option for this. There's a front camera, a back camera, and you have the ability to use the MyRush app, which makes connecting very simple. And you can move it around and get different views. And someone who's helping you can also use it to help video you for the doctor. Smartphones are good because they're typically connected to data plans, and so even if you don't have Wi-Fi at home, you'll be able to use this to connect to the internet. It also has the Rush app, which is the easiest way to connect to your telemedicine visits. You may have a desktop computer that has a webcam. This can be used to connect to your visit, but it's not our recommended choice because it's very difficult to move it around, which you'll need to do the best examination during your visit. Another option is a laptop computer. Many laptops these days come with a built-in camera that you can use for video chatting, and you can also use this for your visit. This is a little bit easier for you to move around, but it only has one camera, and so this also is probably not ideal. With a couple of tools, you'll be able to use your smartphone to get any of the views that we need for the examination. I recommend a small table and a box. It can be a shipping box. It can even be a stack of books. During the examination, we'll want to see your entire upper body, including your hands on your lap. I recommend having the cell phone or camera at about waist height, pointing up towards you. It's not the most flattering angle, but it allows us to see everything. For the legs portion of the examination, just move the camera to the floor, and then we'll be able to see your legs move nicely. You can use your box on the tabletop to set up your camera so that it is pointing at your face for the conversation with your doctor and also for the time that they're examining your face. When you're setting up for the walking portion of your examination, you need to use the box and table in a slightly different way. You want the camera to be straight up and down, so put it right up against the books and then take something small like a pack of cards and push it right up against the edge to hold it there. Don't move around. That'll make your doctor seasick. It's better to put your phone down somewhere stable. If you put the phone about 2 feet away from you, propped up on a steady surface so that your head and shoulders and some of your arms are in the picture, that'll be the best way for your doctor to see what's going on during the conversation. You may feel like there's plenty of light in the room that you're in, but your camera may not see things the same way. Adding a small lamp can go a long way to lighting up your face so that the doctor can see you. You want to make sure that the light is coming from directly in front of you or from both sides. If you put the light off to one side, only one side of your face will be well lit, and you'll get shadows on the other side, which will make it difficult for your doctor to see what's going on. When you're setting up and there's a window in the room, you want to make sure that it's not directly behind you when you're videotaping. It may seem like a good source of light, but in reality, it just means that your doctor won't be able to see your face very well. All you need to do is just turn everything around so that you're facing the window, and all of a sudden you have a beautiful source of light for the walking portion of your examination. Please don't wear big baggy clothes or pajamas. At the moment, many people are at home with childcare responsibilities and pets to take care of, but for the time that you are having your video visit, please try and find somebody else who can take care of your child or your pet for the hour of your visit. When you're at home, everyday activities are going on all around you, and those can be pretty noisy. However, background noise can really be an impediment for the doctor to hear what you're saying and for you to hear what your doctor's saying to you. As much as you can, if other people in your house can delay noisy activities, or if you can find a quiet place to sit, That would be really helpful for your video visit. Thanks for joining us. I hope this is helpful as you're getting ready for your telemedicine visit.